Good afternoon, everyone. Welcome to our webinar on gender and COVID-19. I'm Christine Tremblay. I'm a researcher at the chair of UN Studies in Peace and Justice. Last spring, we had this great idea to organize a gender event with the chair and the UN Youth Impact. And the theme of the event that we wanted to organize was on ending violence against women and girls to achieve SDG 5 on gender equality and the best response of states. But then came COVID-19 and the pandemic, and the event was canceled. Most of the world went on lockdown to control the pandemic. For us, the lockdown meant working from home, studying from home, minimizing the contact with family and friends, homeschooling for children. But how is it for women and girls living in unsafe environments and facing daily threat and violence as the door closes and isolation begins? Since July, UN Women has issued 3 reports on the impact of COVID-19 on women and girls and revealed very alarming numbers. I quote, "In the past 12 months, 243 million women and girls have been subject to sexual and physical violence by their intimate partner." And this is a conservative number, which is likely to grow as security, health, and financial stress increase due to the lockdown measures. Will the pandemic derail the hard-won progress on gender equality? How can we protect those gains in time of emergency? Those questions have triggered this webinar. So what we propose to do today is to sketch first the issue and understand those statistics with one of the authors of the UN reports. Then we will move to a response from Colombia and the Eastern Caribbean to this issue. Speakers will discuss those responses and if those responses are helping protecting the gains on gender equality and violence against women. We believe it's a perfect moment to take a small step back, especially now that we're celebrating the resolution 1355, and to assess the pandemic's burden on women and girls, and critically look at the solution proposed by Colombia and the Eastern Caribbean to tackle this issue. Let me now introduce briefly our 3 amazing speakers for this event. First, we have Ms. Antra Bat. She is a statistics specialist in research and in the research and data section of UN Women in New York. She's a key contributor to many of the UN flag report that the UN Women is publishing. Today, she will discuss those 3 UN Women reports that I was telling you about and data collection during the pandemic, including the UN Women Rapid Gender Assessment response. Our second speaker is Professor Lina Cepedes-Baez. She's a Colombian lawyer who graduated from the Universidad del Rosario in Colombia. She's a full-time professor at the law school of that university. She will discuss the best practice of Colombia and the access to the justice system during the pandemic. And finally, last but not least, our third speaker is Ms. Toni Bradber. She is the representative ad interim at the UN Women Multi-Country Office of the Caribbean. She worked for many other UN Women multi-country offices and established the one which is currently in Haiti. She will introduce the new Spotlight program for the Caribbean, aiming at reducing family violence. But first, as I said at the beginning, Ms. Entrabat will discuss the issue of violence against women and girls during this COVID-19 pandemic. Ms. Bat?
Thank you very much, Christine, for the introduction. I'm going to try to share screen so we can have a presentation alongside hitting slideshow. Okay, so hopefully you can all see my screen. So hi everyone from New York. So early on in the pandemic, as Christine was mentioning, UN Women jointly with the Gender and COVID-19 Working Group, we released a spotlight paper on gender, COVID, and the SDGs, which asked this very critical question: that will the pandemic derail hard-won progress on gender equality? Most of the discussions that we presented in the paper that I'm pointing to right now drew attention to the gendered impacts of past epidemics, and they were mostly meant to serve as a warning sign about what could be happening in the future and how policy makers can avoid such a debacle by mainstreaming gender into their responses. But clearly, that did not happen, and gender was not prioritized enough. And what we are seeing now with the emerging data and evidence is that we only are able to underscore and confirm the premonition that the pandemic is indeed having a disproportionate impact on women and girls, which we have summarized in our two recent reports, from Insights to Action and the Gender Snapshot 2020. So in today's presentation, I will be presenting some of the overarching findings that are coming out from these reports. I only have 10 to 15 minutes, so I'll try to be brief, but I do encourage you to engage with the PDFs links that are available here. I'll also share the presentation with the organizers. So I really encourage you to engage with the PDFs for a deep dive later on. So now jumping into to the evidence directly. From the evidence we have thus far, it is clear that COVID is indeed exposing and exploiting existing inequalities and is affecting women and girls in multiple dimensions: their health, which is the SDG Goal 3, economic impacts, the Sustainable Development Goal, sorry if you're not familiar with that acronym, SDG 8, unpaid care work, which is SDG, a particular target of the SDG 5, and then, in addition, we have a shadow pandemic of gender based violence, which is looming large and which is also going to be a major part of the talk of the other presenters as well. So, starting with some of the health impacts, I do want to mention that this very somber statistic that more than 58 million people have been infected with the virus. We've lost more than 1.3 million lives. Men overall account a higher share of the confirmed cases, but in the ages of 85 and above, women are a higher share of the confirmed cases. The main issue, though, is that these data are still quite incomplete. Many questions remain unanswered. As of November 1st, the WHO is getting reports of case information by sex and age only for 28% of the case information. And this is just the disaggregation by sex and age. We do not know anything at all about these cases by other important factors such as race, ethnicity, migration status, gender identity, disability, and so many other important characteristics. But let's for a moment also go beyond just even the immediate impacts of this crisis, which is even more concerning, is the fact that there is a diversion of funds to the pandemic's response, which is important, but is hampering the access to critical needs of women and girls, such as to reproductive and sexual and reproductive health services. So let's take a concrete example. Looking at the target 3.1 of the SDGs, maternal mortality ratio. As you can see here on this slide, I just want to point to two very small but telling numbers, that as of 2000, there were about 342 maternal deaths per 100,000 live births. And by 2017, we had done a lot of progress and we were down to 211. But now, with emerging evidence from the pandemic, what we are seeing is there could be quite a reversal. So, projections show that there could be anywhere between 24,400 to more than 113,400 projected additional maternal deaths due to the pandemic. And these are projections, but we are also seeing a confirmation of these projections from the real time data that's coming in from the WHO. So, just to give you one quick example, in Zimbabwe, the number of cesarean sections that were performed have decreased by 42% between Jan and April 2020. And in Burundi as well, the skilled births have fell to less than 5,000 in comparison to 30,000 in 2019. So we are seeing a lot of restriction in coverage of essential services that women and girls do really need. Now, moving on to some of the other impacts that we discuss in the reports, we talk about the economic impacts as well, which are crucially important and in some cases are even intertwined with the health impacts. So, in some cases, women are actually sacrificing their health for economic security. Taking the example of healthcare workers, what we see is that 70% of the health and social care workforce are women, and because of the nature of their job, they are at a higher risk of exposure to the virus. Again, we see that in the emerging data as well, where some of the data from these 5 countries are showing and confirming that amongst all infected healthcare workers, 72% are women. We are also seeing that in general, the sectors that are losing more jobs are feminized sector. Take the accommodation and food services sector, for example, which has been devastated by job losses. In most countries, and you will see these statistics in our report, women are overrepresented in these sectors, often with a tenuous hold on their jobs. There is also growing evidence, and this is really just very recent evidence, which is showing that women are facing huge care burdens, because of which they are abandoning the labor market altogether. So as you can see from this graph on the left hand side, um, starting from Q4 of 2019 until Q2 2020, you can see that we have about 48% women which are outside of the labor force in comparison to 30% men. This is amounting to about 28 million women who are now out of the workforce. And this is really due to the unpaid care burdens, because just to show you an example, if we look at just the European Union and we look at the absences in or leave absences during the time of lockdowns, when the childcare responsibilities were at their peak and schools were closed, daycare centers were closed, as you can see, this red line of women has been consistently higher than that of men. So you are seeing indeed that women are just bearing this disproportionate burden of unpaid care and domestic work. So now I think this is a good segue to talk about unpaid care and domestic work, which is also, as I mentioned, one of the targets of the SDG 5. Before COVID, we knew that women nearly did 3 times as much domestic unpaid care and domestic work as men. And this ratio really changes a lot depending on the context that you look at. Because of COVID, we know that many things happened. Schools and daycares closed, children were at home, more people were at home in general, and there was this movement to remote learning as well, because of which women have had to make some very radical changes in how they spend their time. Many women have found themselves juggling increased unpaid care work while contending with reduced income, the thing that you just saw on the slide before this. But also, many have had to even make a choice between full-time work and taking care of their children during this pandemic. The main issue, though, is that the data on time use is very difficult to come by, even generally. That said, UN Women has been running some rapid gender assessment surveys, which are allowing us to assess the gendered impact of this pandemic, especially on this very important issue of unpaid care and domestic work. And as you can see on this slide, I'm showing some data from the Asia and the Pacific region, which is confirming that both men and women's workloads of unpaid care and domestic work have increased during the pandemic, but women clearly continue to do the lion's share. And what is really interesting is that there is a very low base from which men are starting. So this graph on the right is from a 2019 time use survey from India, where you see huge participation gaps in unpaid care work in the country. So about 81% of women are participating in unpaid domestic services for household members versus 26% men. So huge gender gaps. So what I would like to say here is that it is great to see this silver lining that both men and women are doing more in this pandemic, but hopefully this trend will hold, it will continue, and will bring about a long-term change even in social norms post the pandemic. Um, I think it's also important to recognize, and again, this graph on the right is showing you some very recent data of an Ipsos poll in collaboration with UN Women, where we are showing that across 16 countries, the impact of the pandemic on childcare responsibilities. So you can see that, yes, again, men are doing more as well. But as you can see, before the pandemic, and very relevant for only these 16 countries that were interviewed in the where respondents were interviewed as part of the survey, you can see that before the pandemic, about 24% of women in the sample were doing childcare full time, so even more than 9 hours per day, which has now increased to 36% of women. So we are seeing these huge changes for both men and women. But again, men are starting from a low base, and then women continue to do the lion's share, is very important to recognize. The worst affected, as usual, are those who are furthest behind, those women and girls who live in the poorest areas where they have to walk farther and farther down to collect water for their households. And poverty is not just in rural areas. Even girls and women who live in urban slums, who take on the burden disproportionately of unpaid and care and domestic work, have to go to crowded community pumps, for example, to collect water, which again exposes them even more to the virus. So this is just a small graph that I'm showing you, which shows you disparities in access to hand wash and soap facilities, which are critical to protect oneself from the pandemic. And you see these huge disparities just looking at the wealth quintiles. So just want to underscore that even within this group of women and girls, the worst impacted are those from the poorest groups, but also those who face multiple and intersecting inequalities. So overall, all of this slowing economy, job losses, lack of social protection, everything is also increasing extreme poverty. Women were already more likely to live in extreme poverty than men, and now as a result of this crisis, we are seeing a resurgence in extreme poverty affecting women and girls the most. And just leaving you with one main statistic that according to projections that were commissioned by UN Women in UNDP, we are seeing that by 2021, some 435 million women and girls will be living in poverty, extreme poverty, which is defined by less than $90 per day, including about 47 million women who have been pushed into poverty specifically because of COVID-19. And this graph is also really telling because it shows you that even by the end of 2030, women and girls will continue to be the majority of the extreme poor. And now, finally, I would like to also talk a little bit about the impact of school closures, which is very closely linked to this issue of violence. That we already know now that some 11 million girls of pre-primary and tertiary education age are at risk of not returning to school. We also know from past pandemic experience that when there are prolonged school closures, there is a resurgence of harmful practices and violence and spikes in child marriage as well. Finally, in addition to the harmful practices that I just mentioned, violence against women continues unabated. It's reaching epidemic proportions with COVID-19, and it's also now being called the shadow pandemic. Data are scarce, but we know that the levels of domestic violence and sexual exploitation spike when households are placed under increased strains that come from security, health, and money worries, and also when they are living in cramped and confined living conditions. Those conditions also are a place where many violent partners may use confinement to further exercise their power and control. We are seeing some emerging evidence from some countries. So we have some data from Argentina, Cyprus, France, and Singapore, where reports of domestic violence and calls to hotlines have been increasing during the first weeks of the lockdown when physical distancing measures were put into place. At the same time, in some regions, we are also seeing that women have less opportunities to be able to put into social contact some of their worries. So even before the pandemic, we were seeing that about less than 40% of the survivors of these crimes sort of, sorry, even sought any help of any sort. And now with these lockdowns that have sort of taken place, there is even a reduced opportunity for survivors in some countries because of which reporting may even drop further. While most countries have laws for domestic abuse, the implementation and enforcement they remain weak, and access to justice, in fact, many a times remains elusive. And in the context of COVID-19, protecting women from violence must be a standard part of recovery packages. So, UN Women, in our report, we have been advocating for three key areas. That is to ensure that survivor services, are regarded as essential, they remain open and are adequately resourced, and are also put on high priority on police and justice responses, and also that there is greater response and support to hotlines and women's rights organizations that often work on the front lines. So overall, we do need urgent action to set us back on track to achieve the SDGs and to achieve gender equality in general. So on this slide, I'm just leaving you with all of the different policy responses that UN Women has been advocating for, so that gender is front and center at the response to the pandemic. So with that, I'll hand over back to Christine. Thank you very much once again for the opportunity to present, and I look forward to engaging with you all during the question and answer session. Thank you.
Great. Thank you, Antra. Thank you. Just to remind you that within the chat function of YouTube, you can put your question, and I have colleagues who are there to take them so that we can ask them to our speaker at the end of the session. Yes, thank you, Antra. You sketch a very good general overview of what's happening, what's the impact of COVID on women and girls since the beginning of the pandemic. Now I would like to move to some of the best practice of Colombia. And I would like to give the floor to Professor Lina Cepeda-Baez to discuss this issue with us.
Thank you, Christine. So greetings from Bogota, Colombia. Thank you all for being here. I want to thank the organizers. Particularly, I want to thank you, Christine, and all your team for the invitation. Today, I'm going to talk about some of the strategies Colombia has implemented to tackle gender-based violence in the context of the COVID-19 pandemic. I'm going to offer a critique of these strategies. Strict quarantine started in March 24 for the entire country, and it lasted for 6 months. Although during those months, the terms of the quarantine were gradually relaxed to let economic sectors get back to work, such as those related with infrastructure, manufacture, and transportation, and later on with commerce and some related to education. Currently, most activities are back with limitations. In September, the government said that the quarantine came to an end, and we are something called like intelligent isolation, intelligent strategy to go back to our usual life. Of course, this is a new normality. We have limitations related to working hours and to the number of people that are allowed in closed spaces, except those that entail large crowds or are related to the bar or discotheque industry. Those who can work remotely from their homes are doing so. Those who can't are back to their workplaces or have lost their sources of income. This is especially true for those in the informal economy, since their informal economy depends on present social interactions and on people populating the streets. According to the Colombian Statistics Office, 57% of the people in Colombia are working in the informal sector. From the beginning, the Colombian national and local governments passed a regulation not only to establish the restrictions associated with the quarantine, but also to secure that basic services such as access to justice and attention and prevention of gender-based violence would adapt and continue. Since the beginning, it was clear that that was going to be very challenging, given the technological limitations of the government in general and of the judiciary in particular. Technology depends on electricity, and there are places in Colombia where this service is still not granted. Furthermore, the lack of digitalization of files, the financial problems of the judiciary and the government agencies, and the lack of training on digital tools of judges and public servants posed a significant hurdle to the transition to the new reality of the pandemic. Also, according to the 2020's Digital Quality of Life Index, Colombia is ranked as one of the countries where internet is least affordable. This situation places obstacles for the general population to access a service that during the pandemic has become essential to realize fundamental rights, such as education, health, and access to justice. In this context, in March 22 of this year, the national government issued Decree 460 to guarantee the continuation of the service of what we call Comisarías de Familia. I'm going to call it in English, the translation I'm going to use is family commissioners. To provide, basically, the government issued this decree, basically to provide or to assess or to secure the attention and prevention of domestic violence, the service to prevent and attend domestic violence. To do so, this decree ordered first to prioritize actions to protect evidence, especially when there is a threat to the right to life or to physical integrity of the victim. Second, to offer transportation when it is needed to relocate victims of domestic violence. Third, to provide virtual and or telephonic legal advice and psychosocial orientation. Fourth, to hold virtual hearings. And fifth, guarantee in-person services when needed, among other measures. Family commissioners are administrative authorities in Colombia in charge of protecting the rights of children and other family members in the context of domestic violence. They were established in 1989 and they were linked primordially to the protection of minors at the beginning. In 1996, when Law 294 established for the first time in Colombia the crime of domestic violence, family commissioners' functions were widened to turn them into a sort of first responders. Hence, the law provided that any person suffering domestic violence can ask family commissioners to order protection measures, such as the eviction of the aggressor, relocation of victims, psychosocial attention for victims, mandatory therapy for the aggressor, among other measures. Law 1257 of 2008, known as the Law to Prevent and Punish Violence Against Women, reiterated that family commissioners had the obligation to order these protection measures to prevent and attend gender-based violence in the context of domestic violence. The effectiveness of family commissioners before the pandemic in tackling gender-based violence in the context of domestic violence in Colombia had been very low. According to the 2019 Ombudsman assessment of the institution, family commissioners face several structural and functioning challenges, such as lack of appropriate budgets, infrastructure, and human resources, and overburdened with different types of responsibilities. Also, their appropriation of relevant international and national regulation of gender-based violence is scarce, and their follow-up on the protection measures they issue is deficient. Several studies have noted that family commissioners do not have a gender perspective and privilege an approach that protects the families and not necessarily women and girls. The situation is troublesome if we take, the situation of family commissioners is very troublesome if we take into account two factors in Colombia. The first one, according to the data of the Attorney General Office, during 2019, more than 30,000 persons suffered sexual violence and more than 88,000 suffered domestic violence, where more than 80% were women in the case of sexual violence and more than 78% in the case of domestic violence. And there were 231 women victims of feminicide. And the second factor is, according to the same database, in the case of sexual violence, the perpetrator was a relative in 43% of the cases, and a known person to the victim in 26% of the cases, and a former intimate partner in 15% of the cases. These figures are staggering for several reasons. I will point only to two reasons. Underreporting, since these data come from databases that were effectively brought to from cases that were effectively brought to justice. And second, who is the perpetrator? The perpetrator is a relative, a close person, former partner. These reasons indicate the significant incidence of gender-based violence in domestic settings and or coming from people that are close to the victim. For this reason, it was easy to foresee the impact quarantine was going to have on women and girls in the country and worldwide, as there are studies from international agencies such as the WHO that confirm this trend, that is that women face significant violence in the spaces that are supposed to be safe as the home and perpetrated by people that are close to them. Decree 460 was issued to prevent the escalation of gender-based violence and to ensure an adequate response to it. Also, the national government and the government of Bogota and other local governments, municipal governments, enhanced their emergency telephonic attention of gender-based violence. According to the Bogota Secretary of Women, by May, the number of calls had augmented in 230%. According to the National Agency for Women's Equality, in the national line, the calls augmented in 142%. These lines offer legal advice and psychosocial support. Also, they reroute the telephone calls to other authorities, such as the police, if needed. Having in mind that making a telephone call during the quarantine could be difficult due to the lack of privacy, several Colombian municipalities and capital cities made alliances with supermarkets and drugstores to provide safe spaces for women to report gender-based violence, find legal and psychological support, and activate their referral pathways. To prepare this talk, I look for updated information and data regarding the effectiveness of these measures that the national and local governments, principally Bogota, have taken. It has been difficult to find updated information apart from the one that I have already shared with you all. Even without that information, it is possible to draw some conclusions of the implementation of these measures I have talked about. First, the pandemic has accelerated the adoption of digital technologies in every aspect of our lives. Regarding access to justice and prevention and attention of gender-based violence, that's a welcome phenomenon, since the judiciary was really behind in this aspect and other government agencies. The transition from in-person to remote litigation has been, to say the least, difficult and sometimes very traumatic. Proper attention to gender-based violence involves administration of justice, and judges and courts were not prepared to shift to remote litigation. Even though higher courts were better prepared, the bulk of gender-based violence gets litigated in lower courts where there is a scarce technology to digitalize and receive information. For instance, some lower court inboxes have space limitations that curtail the proper filing of documents. However, the Colombian state has shown the will to keep its justice system working and up to date. Second, family commissioners had been facing criticism regarding their attention of gender-based violence before the pandemic. And there is no indication that the structural problems that they were facing and the lack of appropriation of gender-based violence knowledge were going to be solved during the quarantine. Even it's possible to say that the pandemic context and the orders of the Decree 460 posed for them an additional challenge that most of them were not equipped to meet given budget, infrastructure, and human resources shortcomings they were experiencing in prior years. Third, centering the response to gender-based violence to family commissioners during the pandemic leaves aside gender-based violence that is not related to the family or to intimate partners. This is especially serious in a country trying to implement a peace agreement, with a history of armed conflict-related violence that has affected women and girls, and with significant incoming immigration. Fourth, unemployment have especially affected women, paving the way for their loss of bargaining power in their households and exposing them to the potential increase of gender-based violence. The National Statistics Office has stated that unemployment for women has increased in 28% comparing July of 2019 to July of 2020. Additionally, women between 25 and 54 years of age are the most affected population. Every two women that lost their employment, only one man did for the same period. Finally, I want to leave a positive note. It is important to say that the pandemic has made visible gender-based violence and other gender-related dimensions of life that were not front and center before in the country. Our challenge is to maintain this momentum and keep on designing and implementing appropriate measures to effectively eradicate discrimination and violence against women. Thank you.
Thank you so much, Lina, for sketching the response of the Colombian government and for your critical view about those strategies that the government adopted. So I hope there's going to be I have a few questions, but we wait after in the period of question and answer. But please, if you have questions for Lina, put it in the chat. So I move on to the last part. Ms. Tony Bradburn will discuss what they are doing in the Eastern Caribbean to reduce family violence.
Hi, can you see me? Are you seeing my screen? No. In the meantime, what I will say is good morning to everyone again. And just to clarify, the presentation will be beyond just the Eastern Caribbean. We're also going to be looking at the Caribbean more broadly because the UN Women Multi-Country Office in the Caribbean covers 22 countries and territories in the English and Dutch-speaking Caribbean. I believe you should be able to see my screen now.
Yes, we are.
Fantastic, great. So my colleague, Anita, did a fantastic job of telling you exactly what the global impact has been of the COVID-19 pandemic, how many people have been affected, and what that means more generally around the issues of gender equality and women's empowerment and the silent pandemic that we're seeing of gender-based violence. One of the main things that we are also seeing in the Caribbean is similar to the world, a lot of the affected cases in terms of the persons who are most contracting it are women, but those who are dying most are men. We have in the Caribbean, especially across the CARICOM region, for those of you who may not know, the CARICOM stands for the Caribbean Community, we have occupational sex segregation. And that occupational sex segregation mainly looks at women having jobs in low-paid sectors and in sectors that are most affected by the COVID-19 pandemic. So women in tourism, women in the hospitality sector, those working in accommodation and food services are the most hardest hit right now by the travel restrictions that we see with the COVID-19 pandemic. And the majority of workers in these services are ranging from 62% to 69%, also being all of the workers in the Caribbean. Our colleagues at WFP, FAO and CARICOM did a rapid assessment of food security and livelihoods. And what we were seeing is that people's work was increasing significantly. And this is something that Anita also spoke to. What you're seeing as the informal daily casual labor, what we know as unpaid care work, went up by 79%. And those who are doing also that work lost salaries. At 79% of them lost salaries, sorry. Those who are relying most on support from family and friends 62% of those were those who lost jobs. They were relying more on their family and friends. But remember, at this stage, you're also not allowed to see many family and friends. A lot of persons who are relying on grandparents for support, a lot of people who would have been experiencing violence in the home and experiencing that support are now not able to go to a family member's home or friends. Has the household income changed over the past 2 weeks? We knew that at least in April, this was 49% of persons who were women experienced a loss of the jobs or at least reduced salary, 43% men. Many people had to resort to secondary or alternative activities, only 6% and 5% women. That's not a huge difference, but it does demonstrate that what we were seeing, if we start doing a bit more analysis around those unpaid care responsibilities that Anita was speaking to, we saw quite clearly. So what does this mean as well around how we can start supporting women who are experiencing violence against women and girls? One of the things that we've been seeing is around social protection. There's been an increase in social protection, persons reaching out to social protection because they have lost, as we saw, 49% women lost their jobs, 43% men. People are now starting to depend more on social protection. But does this give us a full picture of what economic empowerment really means for women and girls? No, it doesn't. Because what studies have shown us globally is that there's inconclusive data with regards to the fact of whether social protection services and cash transfer programs specifically lead to women having a bit of relief from situations of intimate partner violence in particular. This is probably because a cash transfer program alone is not sufficient. From some of the research that we have done in the Caribbean, about 90% of women on one particular cash transfer program in the region are survivors of violence or are still in situations of violence. So what we need to be looking at is not only enhancing the economic security and the well-being of the household through these cash transfer programs, but what are also the strategies for reducing intra-household conflict? Are we also making sure that when you're on a social protection program, like a cash transfer program, you're also benefiting from a conflict resolution program that a government provides, for example? In a country like Grenada, the government through the magistracy supports through a civil society organization, a program for men and boys who are first-time batterers so that they can start changing their behaviors around this. How often do we link those programs with the economic security of a cash transfer program? That's something that we have been promoting in the region. The other issue is general women's empowerment. Economic empowerment alone is not empowerment fully. You have to be looking at strengthening self-esteem, strengthening the opportunities for women to increase their employability, recognize what their skills and trainings are as well, so that they can get additional certification. So this is one comprehensive approach that we have been investigating in a few countries to address what we've seen. But the truth is that what we're seeing requires not just piloted action, but overall action. The issue with violence against women and the girls in the Caribbean was at epidemic proportions before the pandemic. We had a situation of few prevalence surveys. We never had prevalence data in the Caribbean. We now have prevalence data. And we have a Caribbean Women Count website, which you can go to at https //caribbeanwomencount.unwomen.org. And then you can get the data for Grenada, Guyana, Jamaica, Suriname, and Trinidad and Tobago. And the data is telling. What it tells us is that across the Caribbean, of the countries that have experienced this, every country is over the global level, and some to the point where at least 1 in 2 women have experienced violence in their lifetime. Now, what you also see from this particular data on the website is the risk factors. And you'll see that what COVID-19 is actually doing is exacerbating the risk factors for women who were already experiencing violence. Some of the data shows us that 1 in 4 women in at least one Caribbean territory was at present experiencing violence before COVID-19. Now with COVID-19, we know that that the risk factors that led to them experiencing that violence in the beginning has probably increased. So we've seen situations where the risk factors across the Caribbean include frequent arguments. It includes issues around whether you believe that you should be beat, whether it's a woman who believes so or the man who believes so. We also see issues around alcohol use and employment and employability. So these are the things that COVID-19 has been really exacerbating. And not only has it been exacerbating it, it has been reducing access to the relief that a lot of survivors and perpetrators would find in terms of other means to be able to manage conflict outside of your household. The house is usually a place of safety, we assume, but for many it is not. And with the restrictions, even if it is one where you're intelligently choosing to stay at home, we're seeing that people don't have the kind of familial or friendship support that they used to be able to manage this situation. And this is why when the European Union and the UN collaborated on the Spotlight Initiative, we never recognized how timely it was going to be. We knew it was timely, but then COVID-19 hit and we recognized that it is critical. So the Spotlight Initiative to End Violence Against Women and Girls is an EU and a UN initiative that is not only being implemented in the Caribbean, it is actually a worldwide initiative. And its focus in the Caribbean is on family violence, but its focus across the world is on the different issues and areas of gender-based violence, and specifically violence against women and girls that are most rife in different areas. So in the Pacific, it's domestic violence. In Latin America, it's femicide, for example. So the comprehensive approach to the Spotlight Initiative is one that looks at 6 different pillars. First, it recognizes that it has to be country-led. So each of the initiatives you partner with a government or you partner with the regional institutions within the space to ensure that the work being done is indigenous. It is context specific. It is not an external 1970s, well, not even 70s, 40s, 50s notion of development where you come in and tell people what to do. No. What we're looking at is informing from what people know needs to be done, because people on the ground have been doing this work for a very long time. So we're looking at the laws and policies, the institutions, prevention measures that have been working, services, essential services, data, and the women's movement. And you can't do any of this work without the women's movement. Then regionally, for each region, you then focus on what you're going to be looking at. In the Caribbean, we are focusing on institutions, prevention, data, and the women's movement. And as our colleague from Colombia was speaking about, we know there's always been a lack of budget. There's always been a lack of budget for this issue. And while we're excited that one of the benefits of the pandemic is that it is raising awareness of where the gaps are, the truth is that it is also in some ways making invisible the fact that this is not only a human rights issue, this is a critical sustainable development issue. You cannot only thinking about how to respond and recover your economy if you're not thinking critically about gender equality and gender responsive measures to transform the economy. Ending violence against women and girls is one of those critical measures, and all forms of social measures need to be taken into consideration when we're developing the recovery strategies. So as you know, this is the 16 days of activism. I hope you know this week is the launch. We will be launching on the 25th, which is the International Day to End Violence Against Women and Girls. And we're looking at reinforcing the need to fund, reinforcing the need to prevent, reinforcing the need to respond and collect data. We cannot do this work unless we have the data so that what we're doing is evidence-based and evidence-informed. We need the funding. Civil society organizations need the funding. Governments need the funding. One of the biggest things about the Caribbean is that we're considered high to middle income. However, the debt to GDP ratios in most Caribbean countries is over 50%. So where is the liquidity to be able to respond effectively? You need the funding to be able to do that. And that's why that Spotlight Initiative is really goal 17 of the SDGs, the Sustainable Development Goals and Actions. So I know one of the main things we want to do is hear from you and answer from you, but I do want to stress that I'm wearing orange today, and we're hoping that on the 25th of November, everybody wears orange. It is important to demonstrate out loud. Sometimes, we think these kinds of things don't make change, but it does. A lot of women survivors say, this is also a reminder that they are not alone. Orange your space. And I want you to know specifically about another way in which you can support this process. UN Women has action coalitions through this generation equality process. They're global, they're innovative. They're supposed to be about mobilizing, catalyzing, and delivering, and ensuring that we do not forget in our response to COVID-19 the importance of centering gender equality in all of the responses. The action coalitions for generation equality are based on gender-based violence. You have Feminist Action for Climate Justice. We still are not quite clear. It'll be interesting to see what the data says around how the changing climate led to this kind of a pandemic or not. We know technology and innovation is happening, and it has been sped up for COVID-19, but who has it been sped up for? We need to make sure that we have technology and innovation for gender equality. We're using it to solve for gender-based violence. There's a coalition on economic justice and rights, as well as bodily autonomy and sexual and reproductive health and rights, as well as feminist movements and leadership. And one of the, I think one of the data that Anita shared and that we know is happening is that the levels of teenage pregnancy, the levels of maternal mortality as a result of COVID-19, it's going to be interesting when we start looking at all of these indicators as well. We have to make sure that we're mobilizing together to get this work done. We really, you can learn more about generation equality on our website, UN Women's website. There's a lot of information so that you can see that how we're using data so that we can learn through these action coalitions to influence and to build and deliver. And the fact is that you can't really look at issues around economic justice and rights or anything else unless you're looking at all of these different tactics. These are the same tactics that you'll see reflected in the Spotlight Initiative, but these tactics are also the tactics that are being used to drive transformational systemic change. So I'm inviting all of you to get involved, orange the world, get involved in your generation equality where you are, and also make sure that you have the data. We have the Women Count website. We have Caribbean Women Count as well, if you're interested specifically in data around the Caribbean. It is all part of the same work and research that's being done. But what we need to be doing is mobilizing to ensure that we fund, respond, prevent, and collect during this time. We have to center issues of ending violence against women and girls in issues of building back better after this pandemic. Thank you.
Yes, great. Thank you, Tony. Very inspiring. And as you know, many students from the UN Youth Impact are listening. So I hope they will grasp what you're saying and get involved in this orange the world. But thank you also for sketching what's happening in the Caribbean and telling us a bit more about the Spotlight Initiative. I've received many questions until now. Maybe we start with one which I addressed to Antra. But if feel free, the two other speakers, if you have something to add to after Antra has answered, then you're welcome to do so. So Antra, what I would like to ask you is what are the response to those UN spotlights reports from the government when they see from the different government of the world, when they see those numbers, do they have a response?
Thank you very much for the question. It's a very important topic, and the reason why we do these reports is because we want policymakers to sort of look at this evidence, analyze it for their respective countries and then put into place actions and policy responses that are really needed to address the situation on the ground. So, I mean, as a person who works on the data and statistics, what we have been doing as part of outreach for the reports is that we've been definitely talking to lots of audiences out there, including policy makers, presenting some of the key findings from the reports. And we've had a lot of questions and even queries from a lot of countries about the data specifically for their country, because at the global level, we try to present the data and statistics at just the broad level. So it does seem like a lot of countries are picking up on these data, these statistics, and want to really look at the situation on the ground for their particular regions and countries as well. So we've had a lot of good response in terms of uptake and recognition of the issues that we're talking about. And hopefully, as the situation emerges and as the pandemic, as the gender efforts are considered to be front and center at the pandemic, we will also see real change in terms of policy responses as well. But I would also like to invite my colleague Jeanette, who is joining us. She is one of the lead authors of the various global reports that I have been summarizing. So if she has any additional insights to provide on this question. Jeanette, if you can hear us, please feel free to unmute yourself.
Hi, Antra. Thank you. Thank you, organizers, for this really quite interesting event. I'm glad I was able, sorry I'm joining a little bit late, but glad to be here with you all. Antra, I think you addressed that question. I would just add that we are seeing that countries are actually waiting for the results from our rapid gender assessments before making and finalizing their gendered responses to the COVID-19 pandemic. And so that has been encouraging, that they're waiting for the evidence and for the knowledge to inform their policies and their response, and to do so from a gender perspective. And I think that's really what we always aim to do and hope are some of the, real impacts of the work that we're doing, at least the work that I'm trying to do and I are doing in terms of the collecting and processing and making available data, evidence, and knowledge. I would also say that some of the work that our colleagues in the research and data section have also been doing is actually taking stock of the policy responses that we're seeing on the ground. Are they gender sensitive? Are countries implementing labor market policies, violence against women policies on the ground in response to the COVID-19 pandemic? And what we are seeing is that there are some really good examples of that. But much more efforts are needed, and that's part of what we're doing here, right? Is advocating for more responses and for a greater recognition of the differential impact that COVID-19 is having on women and girls. And so I do encourage you to go to our data portal to learn more about these different data sources. I'm not going to go into all the detail, but just to say that if you're interested in seeing more about some of these data, they're available at data.unwomen.org. And I'll stop there. I probably took too much time, but thank you.
No, thank you so much for joining us, Janet. Great. Can we talk a little bit about the data collection? Because all of the speakers, you mentioned it a bit, like the difficulties of getting some data during this pandemic. Is there anything done by states by UN Women to try to facilitate and all those data that you're gathering? Should we take them very conservatively, because we know that what we're not getting all the statistics that we should be getting? Who would like to start?
I can start for the Colombian case. I think in Colombia, the National Statistics Office is doing an amazing job. It's called the Departamento Administrativo Nacional de Estadística. It's basically DANE. You can find it DANE. That's the acronym. And so DANE is doing an amazing job, even before the pandemic, in mainstreaming gender throughout all the statistics operations. Basically, they are focused more on the economic aspect of or the social aspect. Even they have a survey called Pulso Social, like taking the pulse of what is happening to society in Colombia, and they ask about feelings, if people are feeling depressed, etc. So I think it's very, we are having very timely information from this statistics office about unemployment, about which sectors are being reactivated, economic sectors, and which are not. Gender gaps in salaries. They launched, basically that was last week, 2 amazing publications about gender pay gaps and also gender gaps in general, with all the information coming from census and the different surveys they have. One of the difficulties is specifically the information about violence. There is a shortcoming in Colombia about that information, that specific type of information about gender-based violence. It has gotten better, I have to say. There are a lot of progress in the last decade. Basically, when I started to work on these issues, it was so difficult. Basically, we had to rely only on the forensic information from the National Forensic Office, and now we have like different sources of information: the Ministry of Health, the Attorney General Office, the assistant lines. But what is difficult now in the pandemic, and that what I was trying to look for when I was preparing this talk, is like how effective, for instance, the measures of family commissioners have been. There is no information, at least that I know of. There is no information of how many women and girls they have attended, how are the referral pathways functioning. It's difficult to know more about what is happening with the telephone lines. So how many people are being referred to X, Y, and Z, and if that attention in the judiciary or the police is being effective or not. There specifically, we are having that specific obstacle, but I have to say that Colombia is producing very timely, pertinent, and important data about gender in general. And we have to work more on producing gender-based violence data, but we had made progress in the last decade.
Thank you. Anybody else who would like to respond?
Yeah, this is Tawny, and I have to apologize to Antra. I was calling her Anita. So I apologize for that. I think, okay, so in the Caribbean, there's the best of intentions, and we have a very strong CARICOM regional Department of Statistics. However, in the Caribbean, we are known to have data deficit disorder on most statistics, not just with regards to gender-based violence statistics. As I said, the first time we had prevalence data on ending violence, on violence against women and girls, was when UN Women collaborated with the government of Jamaica, Staten, and the Inter-America Development Bank to do a survey to have that data. So now we have 5 countries that have that data. That's not enough. We need the entire Caribbean to be able to have that data. Now, the issue with collecting gender-based violence data, and specifically violence against women and girls, is you have to be collecting it in a way that is not going to lead to any more harm for these women and girls. So generally, we do not recommend in the rapid surveys that are being done that you include these kinds of questions, because how are you going to ensure that the services are provided? What we have been doing is looking at the administrative data, the data that's coming from the police, the data that's coming from the NGOs that provide services, as well as the clinics and the hospitals that provide services. Has there been an increase in the persons who are seeking support from the essential services? And that's why we know that there has been an increase. However, one of the things that we are doing through the EU UN-funded Spotlight Initiative is trying to standardize the administrative data collection, because it's not standardized. So you're comparing apples and on oranges. One of the things that Lena spoke to that we know in the Caribbean is that when we see femicides happening, it's generally an intimate partner who has murdered a woman who has a protection order. So we are not even able to really follow up properly to see how these things are being managed. And we hope that what we can do is use some of the technology that we have seen growing as a result of the COVID-19 pandemic to apply it so that we can make sure that the government, who most of them across the region have been very clear, they've signed on to the Convention on the Elimination of All Forms of Discrimination Against Women, Belim do Para, they want to be able to address this issue, but they need the means, whether it's technological tools, to be able to do so.
Thank you. I think Lena and Tony have really given some very important perspectives, but I just want to, I think, add another overarching point, which is about, in general, the problems of data collection during the pandemic. So as Christine was mentioning, data collection is one thing, but then in this pandemic, data collection is the other big issue that we are facing. So as we were talking about the UN Women Rapid Gender Assessments, we've been working in 62 countries to obtain the much needed data that this pandemic requires. And also this is linked to the question that I was asked previously. For example, in Samoa, we are working with the Ministry of Women, Community and Social Development to design the COVID-19 data collection plan and promote the responses from rural communities. So these kind of responses strengthen the data collection efforts because we are directly doing them with the ministries and the countries themselves. We also have examples from Maldives and Pakistan where the rapid gender assessments are being used to inform the socio-economic impact, and they're actually being integrated into the policy responses to COVID-19. But as Tony was mentioning, and also to what Lena alluded to, is the problem that we cannot collect data on violence against women during this pandemic without compromising any kind of safety standards, which is really holding us back on knowing more about this issue. Yes, this is a problem, we recognize it, but again, UN Women is still considering how this can be done safely, even if we are in this pandemic. So I know this question has had a very long answer, but Jeanette, if it would be possible for you to say something about the pilot surveys that we are trying to run in Ethiopia, that would be great to talk to our audience also a little bit about the broader efforts that we are making in data collection, especially on violence against women.
Thank you, Andra. Then just very quickly, because I know that many have already spoken on this question and there's many other questions to answer. But just to say that we are exploring, taking into account the points that have been made by Tony and Andra, how we could gather more information on the surge of violence against women across countries, in particular in countries where the administrative data is really just insufficient and do not provide a good picture of what's happening on the ground and the impact that COVID-19 is having on this very important area. And so there is some work that is being done to really explore, can we do this ethically with the principle of do no harm squarely in center to this work. And so there is, as Andra mentioned, some work happening in Ethiopia, some pilot study, in fact, to see whether information could be collected on the impact that COVID-19 is having on domestic violence in a safe and ethical way. So really the question is is this possible? Can we gather this information in times of crises, not just in times of health crises, but of course this will have relevance for how we collect this data in other situations of conflict and post-conflict, for example. The results of this pilot will be used to inform a broader global study that will focus on collecting data and testing out different modalities for how to collect this data safely and ethically in between 20 and 25 countries. So that's a work that's going to be happening over the next couple of months, and something that I think hopefully will inform not only this current period of crisis, but future work in this area where we need information, but we can't just rely simply on some of the administrative data, especially when it doesn't exist or where it's inadequate for really telling us the picture on the ground. So over to you all. Hope that addresses some of those questions.
Yes, thank you. Thank you so much. I won't try to summarize all the answers, that won't work. I want to move on because we have many questions which we won't be able to all address. I'm sorry about that. One of them that I would like to ask, do you think that the existing human rights framework must be modified by inserting the obligation of a gender-sensitive approach even when states declare a state of emergency? I think Tony wanted to answer that question.
Yeah, I was just saying, I mean, the existing human rights frameworks actually demand that you are gender responsive for the most part. You have the Convention on the Elimination of All Forms of Discrimination Against Women. You have Agenda 1325, which just celebrated, Security Council, sorry, Resolution 1325, which just celebrated 15 years, which is kind of shocking to me. You have the Beijing Platform for Action, which also just this year celebrated 25 years. The human rights frameworks are there. And this is something we had a long conversation on a few weeks ago in the Caribbean, is that we know what we're supposed to be doing. Governments have what they're supposed to be doing. They are there. The issue is, are they being implemented in country? We also have a lot of regional standards. One of the things I wanted to mention, and I'm just kind of going back to get it, is that in the Caribbean, we worked with the judiciary in Trinidad and Tobago, as well as in Belize and Guyana, Barbados and Jamaica, to develop a judicial protocol on gender equality. Because what we recognized, and the judiciaries recognize, they have a Caribbean Association for Judicial Officers, is that they also have to hold themselves, they're duty bearers. They need to hold themselves accountable to the human rights framework. And so within this, and this is actually taken from a Mexican judicial protocol, and that's to show the Latin American Caribbean we're getting over the language barrier, we were able to develop specific considerations around gender-based violence, around child sexual abuse. And I think one of the questions that I just saw, that we're focusing on women and girls, but what about LGBTQI? Women and girls are within the LGBTQI. We can't focus on women and girls unless we're also looking at lesbian women, bisexual women, transgender women. So once we're talking about the issue of women and girls, we're talking about it from an intersectional perspective, which is the human rights way and approach to do this. So we're talking about all women and girls, to just have that clarified as well.
And maybe that's a good follow-up question for Antra. Do you also look at from an intersection perspective when you make those reports? Thank you, Tony.
Yes, definitely. Thank you for that question. I think intersectionality is something that we really feel strongly about. In a lot of our reports, you will see that we always discuss the leave no one behind principle of the that is part of the 2030 agenda, where the idea is really to take an intersectional approach. Some of the examples that I presented in the PowerPoint, which were talking about the inequalities by wealth, by location, by race, ethnicity, I did not have enough time to mention it, but in the report we also talk a little bit about when we talk about the health impacts, we are showing some examples that are coming in terms of the preliminary data from the UK, which is showing us that Black women are about 4 times as likely to die from COVID-19 in comparison to white women. But yes, the key issue is that we do not have enough disaggregations of these data available by some of these key intersectional dimensions. So we always try to sort of insert this intersectionality lens in everything that we do, but are always held back because of the data availability. As I was also mentioning, the reporting of the data to WHO on COVID cases, I mentioned that only 30% of the cases are being reported by sex and age, and that is just one dimension. As I said, we do not know much about gender identity. So also going back to the question on LGBTQI, we do not really have that kind of granular data which we would really like to present. So yes, to answer your question, we always try to bring in the intersectional lens, but we also are always very grounded in evidence. So when the evidence is lacking, we try to bring that front and center. We try to highlight the gender data gaps, recognizing their importance. But unfortunately, we really are, our hands are tied when it comes to data availability.
Thank you.
Jeanette, sorry, I just wanted to see if Jeanette had anything to add to that.
Nothing to add. Thank you, Antra. That was great.
Thank you both. I have also received a question for Lina. Do lawyers in Colombia have a burden of introducing gender perspective in domestic violence cases? And do judges get special training to tackle this issue?
Those are very good questions. First of all, lawyers don't have that burden. Although we here, feminists, are trying to change the way the law is taught. So, for instance, in my law school, we have good news. Next semester, we are going to launch a special concentration on gender and law. We are 7 feminist professors full-time, and we are so happy. We are having the launching event tomorrow, and a lot of students are very happy. So yeah, so we are trying to change the way the law is taught, because we found that a lot of lawyers don't even understand what this means, a gender perspective, or what is gender-based violence. And I think it starts at the university level. So we are doing that. Regarding judges, the judges and justices, all of them have the possibility to take training. There is like continue education branch in the judiciary, and there is a course on gender, and they have sort of like a protocol. It's like a checklist. The challenge regarding that checklist or that protocol is the appropriation. So is there, the judiciary has commission on gender, and they do a lot of training events. Actually, they have events on the 25. But the challenge is the appropriation, specifically in the countryside. So they are doing a big effort. I'm sure they can do more. But I think we have to highlight that there is a conscience about the importance of this, and more during the pandemic, before and during the pandemic, gender-based violence has been front and center in these discussions.
Thank you. Maybe on best practice, one more small question to Colombia and to the Caribbean. Well, in Namibia and South Africa, they both banned the sale of alcohol and narcotics in an effort to reduce domestic violence experienced during the lockdown. Are they doing so? I think maybe Tony mentioned something for the Caribbean, I'm not sure. And what do you believe could be other very notable action to be taken by governments in order to help women and girls against violence?
So as far as I'm aware, in the Caribbean, none of the governments have made that particular restriction. I think it is admirable that governments are trying to find all of the different risk factors and address them. The issue is the same as the issue we were talking about with social protection. A cash transfer program alone is not enough to really reduce and end violence against women or intimate partner violence. It's the same with alcohol. The question about, what the UN does, I think there's something that at least my mother always told me. We have to be aware of what our sphere of influence is and what our sphere of control is. The UN is not a government. We are here to advise and guide governments on what best actions they can take. We support governments as well when they are moving towards actions we don't think they should be taking. So what we would advise governments to do, and what we have been advising governments to do, because at least in our region, one of the issues is because our countries are so dependent on tourism, we've just been thinking about the economic fallout. We're not necessarily thinking about how this economic fallout affects the social ways in which we relate and not relate when it comes to intimate partner violence. So we've been suggesting, one, strengthening your response services. You can't have a woman go to a police station to report her husband and a police officer says, it's curfew, you need to go home. That is an anecdotal report that we've had. We have to make sure that the restrictions are not blocking persons' access to the services they need. And then for those people who seek the services, that is, because there's a question there about what about people who don't seek the services, and that's a lot of people. You need to have, for the people who are seeking the services, quality services and accessible services. So that's one. The second thing is for the people who are not ready yet to seek the services, are they getting the kind of psychosocial support that they need? And the truth is, not necessarily. How can they get that if they're stuck in a home where it's difficult to make a call or to leave to get that support? And this is where the technology, if you have access to the technology, because the data divide is real and it is a gender data divide, and it's not just gender, it's also a class-based data divide. We've been supporting governments in that provision of psychosocial support. How can you make sure that people can get the support that they need while they're there to talk through an issue so that it does not become violent? And this is for both men and women, the perpetrators as well as the survivors. But of course, our focus is on what the data tells us, which is that women are those that suffer the most when it comes to intimate partner violence.
Thank you.
Regarding
Please,
regarding Colombia, I think I think the work the government has to do is related to the justice system. That means prosecution, that means the Attorney General office, and also lower courts. Because I think during the pandemic, the idea of turning supermarkets and pharmacies into safe spaces was great. I think a lot of the private sector got engaged, and that's also a gain in the sense that the private sector is becoming more and more involved in the responses to gender-based violence. And I think that was great in the sense that they are doing a lot of publicity, campaigns, etc. But the problem is that what happens after you contact the person in the supermarket or through the line or through the app, because there is an app in Colombia that is called Ellas. Ellas in Colombia is the plural for she. And the app is there. The app doesn't need data to work. It only needs to get the telephone connection, the mobile connection. But the problem is once you activate the referral pathway, what happens? And there you find a lot of hurdles. So what they have to do is really to invest in more training for the judiciary, prosecutors, police, and to be more, I guess, expedite. One of the problems in this, during this processes, is that they are very long. The justice is basically right now is worse, because not even though you can litigate through internet, they are facing a lot of challenges. So once one person told me that a process not related to gender-based violence but to family law that used to take between 4 and 6 months, a really easy process, now is taking 1.5 years, because basically it's impossible just to make it move. So I think that's one of the things that we have to do. Another thing that we have to, that Colombia has to invest in, is in social sanctions, basically just to consolidate a social response that is of zero tolerance to gender-based violence, and that has to cover every part of society, schools, the family, universities, the government. And I think right now we are doing a lot of progress, but one of the questions I have is, once we are out of the situation, who knows when that happens? Are we going to keep the momentum? Are we going to be able to keep on working at this pace, to have the enthusiasm, to have the engagement of the governments?
Thank you, Lina. We're going towards the end, and I had like one maybe general question which was asked in the registration, which I think maybe it's nice to use to close. And one student asked, do you believe that the increase of domestic violence will continue after the pandemic? So please, you may start, Lina, if you want.
I think one of the things that we have to clarify is how much the reporting is about increase and how much the reporting is about facing underreporting. And so I guess the statisticians have to help us just to answer that question. I guess if we have effective responses, attention and prevention, gender-based violence shouldn't increase. But we have, basically my message is, we have to keep on working on these issues. If we have a decrease, that would be great. Even one woman, one girl suffering gender-based violence is not okay.
Antra or Janet?
Sure, I can sort of go next. So I think Lina summarized it really well. The issue of whether violence will go up or not really depends on the reporting. As I mentioned in my presentation, in some countries where there are services that are easily accessible for survivors, they are able to report these issues, and then you will see an increase or uptick in the violence. But then in many other regions and countries, women and girls simply don't have the possibility or access to report this issue. So you might not even see a spike in the data, but that doesn't mean the violence is not there. So it's really hard to answer this question on whether or not we will see an increase in the data, simply because these are not very administrative or outcome based data that we are looking at. These are more reporting based data, so there are different kinds of biases out there. But I think the more important question is, what can we do to mitigate this shadow pandemic that we know already exists? So we know that violence against women is an issue. It is a shadow pandemic. In these times of crisis, we are seeing spikes in violence. So what are we doing to prevent this, and what are governments doing to respond to some of these issues, according to me, is the more important question to answer at this time. Jeanette, not sure if you wanted to add something here.
Thank you, Antra. No, I think you've covered it. I think, one of the other questions that remain to be answered, we are talking about in many of these countries, increases in calls, as Antra and Lina mentioned, in reporting. And it's not clear if this is an increase in the intensity or if this is, new cases that are coming to light and being reported. And so once we have more information and we can monitor over time the situation, I think we'll be able to answer that question more, with more evidence. I will say, just to echo again what Antra was saying, really prevention. We need to respond to the current crisis and to the surge that we are seeing, but we also need to make sure that we're investing in prevention services to ensure that we don't see a long-term surge in violence against women and girls.
Thank you both. Tony, I want to give you the floor, but just before you may answer that question, but I would like you also again to maybe give us answer this question, like what can students do in order to have an impact on this issue? And maybe you can again incite them to wear orange and take part into those activism day.
Sure. Okay, so the first thing in terms of the answering is that regardless of what the data tells us, we know prevalence is that most women do not report to the actual essential services that they're experiencing violence. So what we need to look at is, are the risk factors for violence increasing as a result of COVID-19? Yes. What can we do to alleviate that, to mitigate those risks? And I think all of the colleagues have spoken quite clearly to what that is. We need to make sure the justice system is effective. And that justice system does not only begin in the courts, it starts with the police, right? We have to make sure that all across the board it's effective. We need to ensure that women are empowered and feel they can leave. A lot of us still have a lot of stories about having to have a partner and having to be with a partner in order to be happy, and what love excuses and what love does not excuse. And this is also with your families. And then we also have to be working with men and boys. This is unacceptable. It's unacceptable. And it has to be stopped. And so I think what students can do is what we are all saying to do, which is advocate. Part of the advocacy is wearing the orange. The advocacy is also among your friends. When people say off-color remarks, you need to say, no, it's not okay. It is never okay to enter into a situation or where beating a woman is justified or being violent to a woman is justified. That has to stop in your friendships, in your conversations, in your family. And of course, you can't be the person who's always, nobody's going to want to talk to you anymore, but there are ways in which you can do it in a way that engages healthily with your family and your friends. That's one. Two, you are already doing this work. You are in law, a lot of you are studying law, a lot of you are studying international relations. Now what you need to do is figure out how can you make this, if this is of interest to you, regardless of where you enter the law, where you enter international relations. I never did gender specifically. I was a generalist, but I also knew that I was a feminist. So anything I do had to be with those principles in mind. And I think that's what the students need to do as well. And then also your citizens. Make sure that as a citizen, you are holding your governments accountable for the things that they have agreed to. And if you are a citizen of a state that has not yet agreed to the human rights frameworks like the Convention on the Elimination of All Forms of Discrimination Against Women, lobby so that they do, because that they're then held politically and they're obligated to deliver on these things for women and girls. So I think that's it for me. I mean, the other thing I said is I think we always have to remember when we talk about women and girls, we're talking about humanity. We're talking about an entry point into how do you deal with families. The LGBT movement requires specific support. And we have to remember women and girls are part of the LGBT movement. I mean, that's how we have an entry point for states that do not legalize gay marriage or sexual orientation yet. We also say, but your citizens are men and women who are in the LGBT movement. So what about those citizens, right? And so when we're talking about violence against women and girls, we have to focus because there's a very specific reason we're talking about it. It is gender-based, it is sex-based discrimination, and that allows us to be able to get to those solutions very clearly.
Thank you. Well, the time is up. Unfortunately, we could speak for hours about this theme. First, let me thank actually my 4 amazing speakers. Thank you. Thank also Professor Alana O'Malley and the chair of United Nations Studies to give us the possibility to hold this webinar. And finally, but not least, Ella McLeod and Izzy Mado-Jemu, my 2 great help, which without their precious help, well, it would not have been possible to organize this event and make it a success like it is.